13 News starts with breaking news.
Two families' lives will never be the same after a chemical emergency claims two lives as a co-worker tonight fights for his. Thanks for joining us, everyone. I'm Amanda Barron.
And I'm Marilyn McAuliffe. Nearly 24 others are being treated tonight. Here's a look at the scene at Catalyst Refiners. It's in Institute, the site of this tragedy along the Nitro Institute line. Emergency crews, they rushed there this morning. This all happened around 9:30 as workers were shutting things down. We're told that's when a chemical reaction happened, creating the fatal emergency.
From the site of the incident to the hospitals that are treating patients, we have team coverage for you tonight. And we begin at Metro 911. That's where we find Jackson Brzezinski. And Jackson Governor Morrissey is set to be there in about an hour.
Yeah, Amanda, that's right. Kanawha County commissioners and Kanawha County emergency management members, they addressed that ongoing situation at Catalytic Refiners Incorporated earlier today. What we know right now is that 2 people have died and over 20 other people are being treated in the hospital now, along with 7 EMS workers who are also being treated. When that leak was reported around 9:30 earlier this morning, emergency management officials say employees at the chemical plant sprung into action wearing respirators and pulled out employees on site who were affected before first responders even got there. The chemical leak was caused by a routine cleaning, but it is believed that a chemical reaction occurred involving nitric acid and M2000A, creating hydrogen sulfide.
Concern is people. The whys and the business model of it, not really our focus. But we know that they were working on a tank to take that tank out, whether the whole plant's going out or not, or just that tank. Our concern is the most 2 dangerous times of a chemical plant's life is start up and shut down. Well, here we are in shutdown, and that's the most dangerous time of its life. It's like landing a plane. Takeoff and landing is the most dangerous times. Starting out and ending a chemical process are the most dangerous times.
Emergency management officials say the way first responders and employees knew they were affected by the gas was by the smell on their clothes and the smell in the air. The company who runs the plant, Ames Goldsmith, released a statement saying they are deeply saddened by the events that took place today and are working with local, state, and federal agencies to determine the exact cause of that incident. And as of now, all shelter-in-place orders have been lifted, but officials say to steer clear of that area in Institute as multiple agencies are still investigating. And as you mentioned, Amanda, Governor Patrick Morrissey will be here shortly. He'll also host his own press conference with updated information as well tonight at 6 o'clock. And of course, we'll have those latest details for you coming up on 13 News at 6. But for now, live at Kanawha County Metro, Jackson Brzezinski, 13 News.
All right, Jackson, thank you so much. We appreciate the report. Let's check in now with 13 News reporter Sarah Davis. Sarah, you were on the scene moments after this leak was reported.
I know you were telling us that you could smell the odor in the air in that busy stretch of the valley, which is also right by West Virginia State University. So can you paint the scene for us at this hour?
Yeah, Amanda, Marilee, the scene looks very different than it did when we first got here just before 10 a.m. I'm going to step out of frame because just in the last couple of minutes, they have actually opened Route 25. It's been closed since the spill happened just after 9:30, but they just recently opened the road back up, and so traffic is moving pretty much normally through here. But all day we've been on the scene here, and we've been trying to inch closer and closer to the scene, and we're probably as close as we've been so far. But earlier we started out at West Virginia State University, and since they are in close proximity, they were actually in a shelter in place as well. And we spoke with the president, Eric Cage, and he just told us how grateful he is that emergency responders were able to get there quickly. Take a listen.
I just want to say thank you. I want to say thank you to all of the West Virginia State community for really coming together to get through this moment of tragedy. But I also want to thank all the members of our community, whether it be our emergency response, our state leaders, for really reaching out to make sure that we were okay here at West Virginia State University. It really does speak to the spirit of collegiality and the spirit of community that exists here in West Virginia.
And right now, as I stand here, we really can't smell much anymore, and there's not a whole lot of activity in terms of sirens or sounds. But it's like I said, it's very different than when we got here this morning. And like I said, the road is open, but crews are still asking everybody that's coming through this area to be careful. Amanda, Marilee.
All right, Sarah, thanks so much. And now to the impact this is having on folks. We know that some individuals are being treated right now.
Yeah, we want to turn to that coverage now to 13 News reporter Savannah Young. She's at CAMC Memorial Hospital, just one of 3 hospitals open today. We know others around the region were just put on certain alerts, but Savannah, they opened their doors, set up tents, and had that hazmat gear on ready to go.
That's right, Amanda. I am at CAMC Memorial Hospital here in Kanawha City. I'm in the emergency area, which is where they had this yellow tent set up just past where my shoulder is here in the parking lot. Doctors and nurses were in full protective gear while treating these patients that have been exposed to the chemical. They said 12 patients today were here being treated after the exposure, 1 in critical condition. As for the 12 patients that were treated, their conditions varied. We're still working on getting the details as to how they are doing following the exposure, but that's what we know for now here at the hospital. We also know some residents that were in the area at the time of the incident came here to get checked out just to make sure that they were okay. So that's what we know here in Kanawha City. I'm Savannah Young for 13 News.
All right, Savannah, thanks. To WVU Medicine Thomas Hospital in South Charleston, now where folks are being treated.
Delaney Wells joins us. Delaney, it was a busy afternoon, and we learned quite a bit from Dr. Tom Takubo today after your conversation with him.
Yeah, Amanda, it was very busy when I was here earlier today around 11:45. There were just ambulances lined up on this street. And if you look behind me, you can see that yellow tent that Savannah was talking about. There was one here to reduce the number of contaminants that come into the hospital. When I spoke to Dr. Takubo earlier, he says there had been 7 patients that had been treated at Thomas. 4 arrived in an EMS and 3 were walk-ins. He says, according to what the DEP told him, if a patient is asymptomatic, they need to be seen for 6 hours. But if they have any pre-existing lung conditions like COPD or asthma, they need to have care for at least 24 hours. And at the time I talked to him, which was around 2:15 p.m., he says no patients had been in critical condition, but he is prepared to see more patients as the day goes on.
Right now, we've not had anything critical here, and so hopefully nobody does turn critical. What they are telling us, though, that some of this delayed exposure can get worse quickly, which is why we want to bring them in and observe them to make sure that doesn't happen.
He says patients have been coming in and experiencing skin irritation and wheezing. And he says they're treating patients with breathing treatments and steroids that can affect the lungs. But we will update you with the latest information. Live in Charleston, Delaney Wells, 13 News.
In a statement from Ames Goldsmith, the company that owns the refinery, they say that they are deeply saddened by the deaths of 2 of our colleagues. They say that they're working closely with local, state, and federal agencies to determine the cause of the incident, which appears to have resulted in the creation of chemical fumes within the building at the facility. The fumes were contained to that one particular building, and they say they're grateful for the immediate and highly professional response of local emergency responders and healthcare providers in the area. I also want to point out we did just get a statement from the Department of Labor at the federal level. They say OSHA will be launching an investigation.
Also, in a statement regarding that chemical spill, Governor Patrick Morrisey says that residents in the surrounding area should continue to follow the personal protective measures issued by Kanawha County for further safety guidance and updates. And he goes on to say that we're working around the clock with local officials to ensure this incident is contained and that all necessary state resources are on the ground to protect the community. Also, Senator Shelley Moore Capito weighing in, saying, I'm grateful to our local first responders and emergency personnel who are on the scene working quickly to contain the incident and keep residents and workers safe. In the meantime, my office is staying in contact with state and local officials, and I encourage those in the area to follow any and all guidance from officials as we continue to learn more. So, of course, we'll keep you updated throughout the evening. We're going to turn our attention now to the forecast. Spencer, you know, during the press conference, we learned, too, that weather had to be taken into account during all of this, of course.
Yeah, and they have, like, on-site monitoring. So we can give you kind of like, you know, hey, the broad, but that's like over at the airport. They certainly know exactly how the wind is blowing, and then they take that into account when they draw their radius of like how far they want to shelter in place and so forth. But as we know, right now there's no risk, so that's certainly the good news at this hour.